Welcome to the Deep Dive, where we take a stack of information and get you well informed fast. Today, we're diving into something that sounds simple, figuring out what someone should eat.
Right.
But when it's a 90-year-old man with type 2 diabetes, it gets incredibly intricate, really fast.
Oh, absolutely. It's not just about the diabetes itself. It's navigating all those, unique changes that come with advanced age. It's a whole different ballgame.
A delicate balance, like you said.
Exactly. Needs a very precise, tailored approach.
And that's exactly our mission today. This deep dive is, well, it's custom tailored to help you understand the specific nutritional and supplemental strategies needed here in this very intricate situation.
Yeah.
We've pulled from evidence-based reports, comprehensive guides, and, our goal is to pull out the most critical, actionable insights, those aha.
Things
when-
that really make a difference.
Yeah, to ensure health, function, and honestly, just a really good quality of life.
That's the ultimate goal, isn't it?
Yeah. Okay, so let's unpack this. When you think about a 90-year-old man, type 2 diabetes, we're immediately dealing with a very different set of, nutritional realities compared to someone younger.
Totally different.
And what's often overlooked, I think, is that the standard dietary advice, it's just often not enough.
Exactly. We need a complete paradigm shift in how we think about their nutrition. The physiology of advanced age. It introduces this complex interplay, metabolic changes, physical limits, unique nutrient needs.
Right.
So, for example, there's usually a natural drop in physical activity, a big shift in body composition.
Less muscle mass.
Yeah, precisely. So a 90-year-old typically needs fewer calories. We're talking maybe 2,000 to 2,600 calories daily. That's quite a bit less than a younger man.
Okay, fewer calories.
But here's the kicker. It creates what's called the nutrient density challenge. Calorie needs go down, but the body's need for vitamins, for minerals, stays the same, or sometimes even goes up.
Oh, wow. Okay.
So every single calorie has to deliver a really high payload of essential nutrients. Every bite counts more.
So it's not just eating less, it's eating, way smarter, way more efficiently.
That's it, exactly.
What are some of those critical age-related changes then, the ones that really impact nutrition?
Okay, well, one of the biggest is sarcopenia. That's the progressive loss of muscle mass and strength.
Right.
It happens with age.
Right, I've heard of that.
And it's particularly bad for someone with diabetes because muscle tissue is a major site for glucose uptake. Less muscle means insulin resistance can get worse.
Ah, okay. That makes sense.
So to fight that, you need adequate high-quality protein. Older men often need about 1.0 to 1.2 grams of protein per kilogram of body weight.
Which translates to?
Roughly maybe 5.5 to 7 ounces of protein foods per day. So really making protein a priority.
Got it. What else?
Then there's a surprising thing called the anorexia of aging. Now, this isn't like a psychological issue.
Not anorexia nervosa.
No, it's physiological. It affects maybe 15 to 30% of older people, things like delayed stomach emptying, altered hunger hormones, even a decline in taste and smell.
Uh-huh.
It all works to suppress appetite.
So they genuinely just don't feel hungry as often.
Exactly. And running parallel to that, their sense of thirst often gets blunted. So they're at a much higher risk of dehydration too. Big problem.
Wow, okay. Appetite down, thirst down.
Hey.
So if appetite is low and, as you mentioned, absorption might be impaired too, what key nutrients are most at risk? Where are the big deficiencies?
Yeah, that impaired absorption in the aging gut is a real issue. Vitamin B12 is a huge one.
Why B12 specifically?
Well, first, about 10–30% of people over 50 just have a reduced ability to absorb it from food anyway due to less stomach acid.
Okay.
And then metformin, that really common diabetes drug, it significantly interferes with B12 absorption. It's a double whammy.
Right. Okay, so B12 is top of the list.
Definitely. We also see common deficiencies in vitamin D and calcium, super important for bone health, preventing fractures.
Yeah.
Falls are a huge risk.
Absolutely.
And then also often lacking fiber, magnesium, potassium, iron, zinc, and folate. It's quite a list.
It is. And you mentioned it all starts even before digestion with oral health.
Absolutely. Think of it as the gateway to nutrition. If you have tooth loss or dangles that don't fit well or dry mouth.
Chewing becomes difficult or painful.
Exactly. And what happens? People often shift towards softer processed foods.
Which are usually
Low in fiber, low in protein, high in refined carbs and sodium. Basically the exact opposite of what someone with diabetes needs or someone fighting sarcopenia. It's this really vicious cycle.
Understanding all these interconnected challenges, wow, it's the crucial first step, isn't it, for anyone supporting an older loved one or even thinking about their own aging.
It really is. Framing the problem correctly is half the battle.
Okay. So now that we've mapped out this unique, complex landscape, let's get practical. How do we actually build an effective eating plan? What are the core dietary principles we should be using?
Probably the most straightforward and effective starting point is the diabetes plate method. You see it recommended by the CDC, the American Diabetes Association. It's intuitive, easy to remember, no complex counting.
Okay, I like simple. How does it work?
You just mentally divide a standard 9-inch dinner plate.
Okay.
Half the plate, 50%, should be non-starchy vegetables. Think spinach, broccoli, carrots, salad greens. They're low in carbs, low in calories, but packed with fiber.
Right.
Great for filling up.
Half the plate, veggies.
Then, 1/4, 25% is for lean protein. Skinless chicken, fish, eggs, beans, tofu. Vital for that muscle maintenance we talked about, and it helps stabilize blood sugar.
Quarter plate protein. Got it.
And the final quarter, the last 25%, is for carbohydrate foods. Things like whole grains, maybe some starchy vegetables like sweet potato, or whole fruits.
Ah, so this naturally controls the carb portion.
Exactly. It prevents those big carb loads that can spike blood sugar. It's a really smart visual tool.
Okay, that makes sense. But you mentioned earlier, it's not just how much carb, but the type of carb. This feels really key, especially with diabetes.
It's absolutely critical. Of the 3 macros, carbs, protein, fat, carbs have the most immediate impact on blood glucose. So we need to be smart about them.
How do we categorize them?
Think about 3 main types. Sugars, obviously, we want to minimize added sugars. Starches here, we strongly prefer whole, unprocessed sources. Brown rice over white rice, whole wheat bread over white,
Right, the complex carbs.
Exactly. And crucially, fiber. Fiber is, well, it's a powerhouse, especially for older adults with diabetes. It slows down how quickly sugar gets absorbed.
To miss out the spikes.
Right. It promotes fullness, which is helpful if appetite is low, and it aids digestion. The ADA recommends at least 14 grams of fiber per 1,000 calories,
Which works out to.
roughly 22 to 34 grams per day for older adults. So consciously choosing high-fiber foods is important.
Okay. And what about things like glycemic index? I hear about that a lot.
Yeah, the glycemic index, GI, and glycemic load, GL, they're useful concepts. The GI basically ranks foods on how quickly they raise blood sugar compared to pure glucose.
Like a speed rating for carbs.
Sort of, yeah. Low GI foods score of 55 or less, things like rolled oats, lentils, most fruits and veggies that are digested slowly, cause a gradual rise, steady energy.
And high GI.
70 or higher. Things like white bread, baked potatoes, sugary cereals, they cause rapid spikes and then often crashes.
Okay. And glycemic load.
GL takes it a step further. It considers both the GI and how many carbs are actually in a standard serving of that food. So it gives more sort of real-world picture of the impact on blood sugar.
Do people need to, calculate this constantly?
Heavens no, not daily calculations. But just understanding the principle helps you make smarter choices, aiming for lower GI, higher fiber options most of the time.
Choose the slow burn carbs. Got it. So putting it all together, what does this mean for the overall balance of nutrients, percentages-wise?
For a 90-year-old, the general guidelines, they sort of suggest around 45–65% of calories from carbs, again, focusing on those complex, high-fiber ones.
Okay.
About 20–35% from healthy fats, unsaturated ones, like from olive oil, nuts, avocados.
Good fats.
Yep. And critically, 10–35% from protein. But, and this is important, really emphasizing the higher end of that range, aiming for 15–20% or even more, specifically to combat that sarcopenia.
Prioritize protein.
Definitely. A Mediterranean-style diet naturally aligns really well with all these principles. Lots of veggies, healthy fats, lean protein, whole grains. It's often recommended.
Yeah, that makes sense. The beauty of the plate method and just understanding these basic principles, it feels empowering. Like you have simple tools to make good choices without getting bogged down in complex rules.
That's exactly the goal. Keep it manageable and effective.
Okay, we talked earlier about oral health challenges, chewing difficulties, swallowing issues. This leads to what our sources call the soft food imperative. How do we make food safe and easy to eat without sacrificing nutrition?
This is such a crucial, practical point for caregivers. The goal is modify textures, yes, but not by just defaulting to mushy, processed, low-nutrient stuff.
Right, so how?
Cooking methods are key. Stewing, braising, slow cooking. These are fantastic for tenderizing meats and vegetables until they're really soft. Melt in your mouth.
Good techniques.
Steaming and poaching are also great. They preserve nutrients well and make foods naturally softer.
Okay, and what about physically altering the food?
Yeah, mechanical softening. Mincing or grinding meats works well. Mashing or pureeing vegetables, think potatoes, sweet potatoes, carrots, cauliflower makes them much easier to manage. A food processor can be your best friend here.
Makes sense. Mash it up.
But here's a really clever strategy. Fortification.
Fortification, like adding vitamins back in.
Sort of, but it's more about enhancing the existing nutrient density of those soft foods.
Yeah.
Sneaking in extra goodness.
Oh, tell me more. How do you do that?
Okay, so when you're mashing vegetables, instead of using water or just butter, maybe use low-fat milk, or even better, plain Greek yogurt. Boom, extra protein, extra calcium. Same texture, more nutrition.
Clever.
Or you can stir unflavored protein powder, whey or soy, right into hot cereals like oatmeal, or into soups, even smoothies. They often won't even taste it.
That's brilliant. Sneaky nutrition.
You can even blend like spinach or kale into a fruit smoothie. The fruit flavor totally masks the greens, adds vitamins, minerals, fiber.
Love that. Okay, and related to this, we mentioned diminished sense of taste and thirst. How do we combat that? Keep meals appealing, keep hydration up.
Flavor enhancement is vital. If things taste bland, appetite drops further. But instead of just pouring on salt, which needs to be limited,
Right.
use herbs, basil, cilantro, mint. Use spices, cinnamon, turmeric, cumin, ginger. A squeeze of citrus, lemon, or lime juice brightens everything up.
Using aromatics and acidity.
Exactly. And don't forget healthy fats like a drizzle of olive oil. That improves palatability, the mouthfeel, makes food more satisfying.
Good point.
And hydration, if they don't feel thirsty.
Water is always number one. Offer it frequently throughout the day, even if they don't ask. Small sips often.
Okay.
But you can also use other fluids. Unsweetened tea, maybe some low-sodium broth or bouillon. And those nutrient-dense smoothies we talked about, they're fantastic for hydration and nutrition, like blending plain Greek yogurt, some spinach, half a banana, fluids and nutrients together. That's a great 2-for-1. Okay, so it sounds like a lot to juggle, but these principles make sense. Can you walk us through what a sample day might actually look like, putting it all together?
Sure. Let's sketch one out. Breakfast. Maybe some rolled oats cooked with low-fat milk for extra protein and calcium. Stir in a tablespoon of smooth peanut butter for protein and healthy fat, and maybe some mashed raspberries for flavor and fiber. Soft, nutritious.
Okay, sounds good. Lunch.
Lunch could be something like a pureed lentil and vegetable soup packed with fiber and protein, maybe with a side of low-fat cottage cheese for more protein, and some unsweetened applesauce. Easy to eat.
Nice. And dinner.
Dinner, perhaps some flaked salmon cooked until very tender, easy to break apart. Served with mashed cauliflower, maybe mashed sweet potato for those complex carbs and vitamins.
So everything is soft, easy to manage, but still nutrient-dense.
Exactly. And those nutrient-dense smoothies we mentioned. Perfect for snacks between meals. This kind of structure ensures you're getting consistent, appropriate carbohydrate intake, high-quality protein throughout the day for muscle, and those necessary soft textures.
These practical tips really show it is possible. A diabetes-friendly diet for an older adult can be delicious, manageable, and really beneficial, not about deprivation.
Absolutely. It's about smart adaptation.
Okay, let's shift gears slightly. Supplements. This is a huge area, right? Lots of conflicting info, lots of bold claims. For an older adult with diabetes, what's the guiding principle here? What should we remember first?
The absolute guiding principle, and the American Diabetes Association is very clear on this, is no routine use of supplements just for diabetes management unless there's an actual diagnosed underlying nutritional deficiency.
Food first.
Always food first. Supplements are targeted interventions, and this is critical. No supplement should ever be started without a thorough discussion with the entire healthcare team.
The doctor, pharmacist.
Doctor, pharmacist, registered dietitian, they need to assess for real deficiencies. Check for potentially dangerous drug interactions, huge risk here, and figure out safe, appropriate dosages. Self-prescribing is just too risky.
That's such a vital point. It's not like picking up some vitamins at the drugstore on a whim.
Yeah.
Okay, so assuming that conversation happens, what are the high priority supplements where the evidence is strong enough to warrant that discussion with the doctor?
Okay, the absolute #1 top priority is vitamin B12
We keep coming back to B12.
because the risk of deficiency is so elevated. Remember, the age-related absorption issues plus the metformin effect, it hits 10 to 30% of patients on metformin.
And the danger is?
The danger is that diagnostic trap we mentioned. The symptoms of peripheral neuropathy like pins and needles, fatigue, maybe confusion or memory issues.
Sounds like aging or just diabetes complications.
Exactly. They can easily be mistaken for normal aging or worsening diabetic neuropathy. So a treatable deficiency gets overlooked, and that can lead to severe, sometimes irreversible neurological damage. It's serious.
Wow. So screening is key.
Routine screening of B12 levels is strongly advised for anyone on long-term metformin. Really important conversation to have with the doctor.
Okay. B12, top priority. What's next?
Next is vitamin D. Deficiency is just rampant in older adults. Affects maybe 4 out of 10.
Why so common?
Less sun exposure, maybe they're less mobile, indoors more. Plus, the skin's ability to synthesize vitamin D from sunlight decreases with age.
Right. And why is D important here?
Well, fundamentally for bone health, preventing osteoporosis, preventing fractures from falls, that's huge for quality of life and independence. But there's also growing evidence linking low vitamin D levels to increased insulin resistance.
Oh, interesting. So it connects back to diabetes management, too.
Potentially, yeah.
Yeah.
Supplementation is often needed. Federal guidelines usually recommend around 800 IU daily for adults over 70. But again, dosage needs to be doctor advised based on blood levels.
Okay. B12, vitamin D, anything else high on the list?
Magnesium is another important one to consider. It's involved in like over 300 enzyme systems in the body. Yeah, including ones crucial for glucose metabolism. And deficiency is pretty common in type 2 diabetes.
So should people supplement?
Increasing dietary intake first is always best: leafy greens, nuts, seeds, whole grains. But if a deficiency is actually confirmed by testing, supplementation can be considered under strict medical supervision. You have to be careful because high doses can cause diarrhea, and it can be risky with impaired kidney function, which is also more common in older adults.
Caution needed. Okay. What about some of those other supplements you always hear about for diabetes, like fish oil, cinnamon?
Right. Okay. Omega-3 fatty acids, so fish oil.
Yeah.
The evidence for a direct benefit on blood sugar control, it's really conflicting, very inconsistent across studies.
So not really for blood sugar.
Its most well-established benefit is for cardiovascular health, heart health. And it's definitely better to get omega-3s from eating fatty fish like salmon or mackerel a couple times a week.
And if supplements are considered?
Must be what the doctor's okay. Especially because high doses can have a mild blood thinning effect. That could interact with medications like warfarin. Needs careful management.
Okay. What about alpha-lipoic acid, ALA?
ALA is mostly studied and sometimes used, often intravenously, for symptoms of diabetic peripheral neuropathy, the nerve pain.
Right.
Oral evidence for that is less consistent. And for actual blood sugar control, generally considered ineffective, and it can increase the risk of hypoglycemia, low blood sugar, when taken with other diabetes meds. So risky.
Okay. Chromium.
Very controversial. Most rigorous, well-designed trials show no significant benefit for glycemic control. The American Diabetes Association specifically advises against using chromium supplements for diabetes.
Good to know. And cinnamon. Everyone talks about cinnamon.
Yes, cinnamon. Results are really inconsistent here, too. Some small studies show maybe a slight effect, others show nothing. While using cinnamon as a spice in your food is perfectly safe and adds flavor.
Right, like on oatmeal.
Exactly. But taking high-dose cinnamon supplements, especially the common cassia type, that should generally be avoided. It contains coumarin, which can potentially cause liver toxicity in sensitive individuals or at high doses.
Okay, so stick to the spice rack, not the supplement bottle for cinnamon.
Pretty much. And as for other herbal supplements, things like ginseng, bitter melon, etc., there's generally just insufficient high-quality evidence from human trials to prove safety or efficacy, especially in older adults with complex health needs. And the risk of drug-herb interactions is really high and unpredictable.
That really underscores the main point, doesn't it? When it comes to supplements, especially for someone older with multiple health issues, informed skepticism and strict medical oversight aren't just good ideas.
They're absolutely essential for safety, for effectiveness. Don't guess. Ask the professionals.
Okay. We've talked diet, we've talked supplements. Let's focus on safety now, given that a 90-year-old is almost certainly taking multiple medications.
Polypharmacy, yeah. Very common.
Yeah. Safety becomes paramount. Beyond just the food itself, what are the most critical risks we need to be hyper aware of, especially regarding drug-nutrient interactions?
Okay, the single most important one, the one to really hammer home, is that metformin-vitamin B12 interaction we discussed.
Right. Metformin blocks B12 absorption.
Exactly. And the danger, again, is that diagnostic trap. The symptoms of B12 deficiency, the neuropathy, the fatigue, the cognitive issues, looking just like aging or diabetes itself.
Leading to overlooked deficiency and potential harm.
Potential severe permanent neurological harm if it goes untreated. It's a really insidious risk.
So what's the practical advice? What should people do?
A proactive surveillance strategy, that's what's needed. Patients, caregivers, they need to be educated about this risk. They need to be vigilant for those specific symptoms, and they need to discuss periodic screening, actually testing serum B12 levels with the doctor.
Don't just wait for symptoms.
Ideally, no. Be proactive with screening if someone's on long-term metformin. And if a deficiency is diagnosed, the treatment is straightforward B12 supplementation, often injections or high-dose oral B12. But importantly, the metformin therapy should usually continue because its benefits for diabetes control are so well established. You treat the deficiency, you don't necessarily stop the metformin.
Okay, that's clear. Manage both. What other interactions should be on the radar?
Well, any supplement that claims to have a blood sugar lowering effect, we mentioned ALA, chromium, maybe things like ginseng can definitely increase the risk of hypoglycemia, dangerously low blood sugar, when combined with prescribed diabetes medications like insulin or sulfonylureas.
Double trouble.
Exactly. We mentioned high-dose fish oil potentially interacting with blood thinners like warfarin, increasing bleeding risk. Also, think about common over-the-counter meds. Antacids, for instance, can reduce the absorption of iron, folate, and B12 over time.
Oh, didn't think about antacids.
Yeah. And some diuretics, often used for blood pressure, can deplete important minerals like magnesium and potassium.
It's a minefield.
It really can be. That's why it is absolutely imperative, non-negotiable, really, that a comprehensive, up-to-date list of all medications, prescription, over-the-counter, and supplements is regularly reviewed by both the doctor and the pharmacist. They can anticipate and hopefully prevent these problems. That communication is key.
That regular medication review seems critical. And beyond specific drug interactions, just the general process of aging, does that affect nutrient absorption overall?
Oh, absolutely. Aging itself impacts nutrient absorption. Mechanisms like decreased stomach acid production, slower gut motility, things just move through more slowly, and changes in the gut microbiota, the balance of bacteria in the gut. All these can impair how well nutrients are absorbed from food.
So even with a good diet, they might not be getting everything.
Potentially, yes. Which reinforces the importance of that periodic monitoring for common deficiencies we talked about, B12, vitamin D, maybe folate, iron, magnesium, zinc. It's about vigilance.
This really drives home the point. It's not just about the food diary. It's about a whole system of care, of vigilance, of communication.
It's exactly. Proactive conversations with the healthcare team, understanding these potential risks. That's fundamental to managing diabetes safely and effectively in advanced age.
So, wrapping things up, we set out today to give you a real deep dive into the unique nutritional and supplemental needs of a 90-year-old man with type 2 diabetes, taking complex info and making it clear, actionable.
And I think the big takeaway is that standard dietary advice, it's often just not enough. You absolutely need a highly individualized, safety-conscious approach.
Right. Which means prioritizing that nutrient-dense diet, mastering simple tools like the diabetes plate method.
Adapting food textures, the soft food imperative, making things easy to chew and swallow, and crucially, fortifying those soft foods to sneak in extra nutrition.
And we navigated the sometimes confusing world of supplements, understanding which ones are genuinely high priority for discussion with the Dr. B12 and vitamin D leading the pack, especially with that metformin link.
Yeah, and which others to approach with extreme caution or probably avoid altogether due to lack of evidence or potential risks, like high-dose cinnamon or chromium.
And finally, we really highlighted the absolute importance of proactive safety, watching for those drug-nutrient interactions, especially metformin B12, and keeping that communication flowing constantly with the entire healthcare team.
Couldn't agree more that vigilance is key.
So this whole deep dive, it really underscores a profound truth, I think, about health in advanced age. It's not just about managing a specific condition like diabetes.
No, it's much bigger than that. It's about maintaining independence, maintaining vitality, and preserving that precious quality of life, making sure those later years are truly golden years.
So here's a final thought for you to consider. As you reflect on everything we've discussed, think about how adapting our approach to nutrition and care for our elders. It isn't just about their physical health stats. It's really about nurturing their continued connection and engagement with the world, their family, their joys. How can these strategies help foster not just survival, but true thriving?